This news update is brought to you by...
Hi, I'm Red Plastic Bag. Anyone who knows me knows I don't like cold. Sunshine reigns in my country. I love it.
Get your sun power.
This is the Noon Barbados Today update for Wednesday, April 30, 2014. I'm Kamar Jordan. Good afternoon. A tense atmosphere outside the headquarters of the National Conservation Commission in Cochrane Hill this morning as workers protest plans for their pending retrenchment. Following a half-hour meeting with General Manager Keith Neblett, angry workers openly voiced their concern about the situation. They're accusing the management of disregarding the last-in, first-out policy in the public service and of treating them unfairly. They spoke with Barbados Today.
People, damage the government, all the war going home. Yeah. It is not fair that we that got years in here going home and his people still working. It is not fair.
These people laying off people that got in 12 and 13 years, and keeping people that got in 18 months and 2 years and all for anything. These things gotta be right.
Today, the NUPW also voiced strong dissatisfaction about the situation at the NCC. Senior Industrial Relations Officer Wayne Waldron is disturbed, he says, about the situation. He's also adamant that the last-in, first-out policy must be upheld, and he says the Barbados Workers Union is standing in solidarity with the NUPW on this matter.
We are seeing that government set a policy, and government should ensure that there's a collective approach to its possibly lasting for us. So we can't have in one breath the Java Service and other boards looking at lasting for us. So when it comes to the NCC, there's a different policy. It causes confusion. And as I'm saying, we are prepared. It will not be business as usual, not that this thing is rectified. We can have a situation where you can allow to interfere with the transparency of the process and get rid of it.
Management was not immediately available for comment. In other news this Wednesday, Education Minister Ronald Jones is rubbishing fears of a crisis at the University of the West Indies amid reports of a high student dropout rate and a decline in new enrollment this semester as tuition fees are introduced. UWI Guild President Damani Paris has already reported a 40% decline in student enrollment, and Principal Sir Hilary Beckel says it's as high as 60%. But Minister Jones says it's an irrational approach to the situation, and he suggests students who opt to abandon their studies should be made to pay.
Now, if it were me, and a student drops out because of $5,625, they should have to pay that. Every cent that were previously expended. Because it is not logical to think like that.
A 35-year-old man who managed to evade lawmen for more than 2 months has been caught. Police report that Andre Clyde Cave of Fairfield Cross Road through the bridge St. Michael was captured during an operation. At the time, he was being driven by Leilani Johnson of number 128 Platinum Avenue, Cane Garden, St. Thomas. According to lawmen, 8 Ziploc bags with a quantity of cannabis and a grey piece of plastic with a loose quantity of drug were found during a search of the vehicle. Cave is currently in custody assisting with what is being described as a major investigation, while Johnson is set to appear in court today, charged with assisting an offender and possession of cannabis.
There's regional and international news after this short break.
Because she deserves it. Make her Mother's Day. Send us a photo and a message telling the world why your mother is simply the best at love@barbadostoday.bb. Enter now for your chance to win lunch for 2 at the Crane Hotel and other prizes. The deadline is May 6th. Mom deserves it. All entries will be published.
To regional news now, St. Lucia's Tourism Minister Lorne Theophilus says negative international press is bad news for the island's bread and butter tourism industry. He's blasting sections of the British press for carrying stories identifying the charred human remains found in a vehicle. The reports claim the remains are those of a prominent hotelier. Theophilus says the reports are disrespectful, and he insists the government will not enter into the realm of speculation.
I can tell you, it's a typical recklessness that comes out, and we have to be we see that wanton disregard for St. Lucia as a destination, particularly displayed in certain corners of the British media. I mean, it is something that I think is downright deplorable.
On to the international scene, Oklahoma prison officials were forced to stop the execution of an inmate after a drug combination went wrong. 38-year-old Clayton Lockett was declared unconscious 10 minutes after the first of the state's new 3-drug lethal injection combination was administered. But 3 minutes later, he began breathing heavily, clenching his teeth, straining to lift his head off the pillow. A short time after, officials reported that Lockett died of a heart attack. Lockett's attorney, David Autry, said the execution was totally botched and it was a horrible thing to witness. Well, certainly sounds that way. And on that note, we end our noon update. Join us again at 6 o'clock this evening. Until then, you can log on to www.barbadostoday.bb, subscribe to our e-paper, or like us on Facebook to get more news and sports. I'm Kmar Jordan. Have a fantastic afternoon and join us again at 6 o'clock.
Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
The high quality of medical care we enjoy today is built upon years of effort by doctors, scientists, and other medical professionals investigating the causes and the potential treatments for disease. In fact, it's often said that much ill health and millions of deaths annually could be avoided. Insights provided by medical research promise to lessen the impact of today's greatest health problems, including diabetes, cancer, and heart disease. The Chronic Disease Research Center, set up more than 2 decades ago, ensures that Barbados and its Caribbean neighbors are at the forefront of this revolution in medical knowledge.
If you don't do this research and you don't actually collect, for example, there are countries in the region that don't collect cause-specific mortality, you won't know what people are dying from. And of course, dying is a zero-sum game. We all die of something, but the question is, when do we die and from what? And is it preventable? So if you don't undertake that research, you can't even begin to try and implement any interventions to help extend the life and quality of life of the population. It is the starting point of...
Professor Clive Landis is the director of the Chronic Disease Research Center. The center, which is perhaps better known beyond our shores than it is at home, has conducted a number of landmark studies towards building a healthier Barbados. The most recent achievement, a valuable discovery about the fight against HIV/AIDS. Professor Landis uncovered a best practice. Barbados is the second country behind the United States to report HIV suppression at the population level. Simply put, the virus is so low in an infected patient that it can almost appear non-existent. But he says there's an Achilles heel in the system, which is being driven by stigma and discrimination.
After a patient has been diagnosed with HIV, we have a tendency to lose the person until they come and present very late in their illness, maybe with full-blown AIDS in the hospital, close to death's door. Now, that is very unnecessary in today's day, because HIV is very treatable. It is as treatable, and I make no exaggeration, as diabetes.
Still, he says it's a discovery which can deliver tremendous benefits. Apart from HIV/AIDS, the CRDC has also conducted other notable research, including the Barbados Eye Study with the National Health Institute in the United States, that also proved significant, and in fact, the research is now guiding eye care for African Americans.
One of the big findings was that glaucoma is much more highly prevalent in ethnic black populations, whereas macular degeneration is more common in whites, for example. And what was interesting, when the known glaucoma genes were actually investigated in the Barbados population, we didn't have any of them. And so the eye studies actually culminated in a very major finding, which is that there is a new glaucoma gene discovered in our population, which is present in persons of West African origin. And so this is now going through the phases. After you make a genetic discovery, you have to go through and narrow down the allele, and then eventually there would be a diagnostic test to see if you have inherited a particular risk gene for glaucoma.
The CRDC has also probed the levels of cancer in the Barbados Cancer Society, which focused on prostate and breast cancer in the population.
A finding that sort of repeats itself over and over is that our black population is, relatively speaking, has a lower incidence of cancer than the comparable population in the US, but our outcomes after a cancer is detected are worse.
In the weeks ahead, the CRDC is hoping to roll out the findings of a study called The Health of the Nation, which took a random sample of the healthy population in Barbados.
What is the prevalence of diabetes, both known and unknown? So critically also unknown. And you know, that is the starting point from which we can then proceed and say, well, this is a problem, or maybe it isn't a problem. You know, until you actually measure these things, it's really just speculation.